In SGH, we have implemented a Rapid Response System, or RRS, designed to improve the safety of hospitalized patients with early identification of deterioration and a rapid and effective response for those with critical illness. The RRS consists of an early warning system, monitoring hospitalized patients for early signs of clinical deterioration in the ward. This allows for intervention by ward nurses and doctors to prevent further deterioration or cardiac arrest. For patients who do not respond to initial intervention or who are critically ill, rapid response teams can be activated. These are multidisciplinary teams designed to bring critical care expertise to the bedside. Lastly, for patients with a cardiac arrest, dedicated Code Blue teams are activated and consistently respond under 5 minutes, improving the success rate of cardiac arrest resuscitations.
Tan, are you okay?
Code Blue activations are triggered for all cardiac arrests in the hospital campus. With dedicated hotlines and push buttons for rapid activation, the Code Blue teams, or CBT, can be easily activated by any healthcare staff. If you are the first healthcare staff to witness the cardiac arrest, it is important to activate the Code Blue team and then perform effective first responder resuscitation while waiting for the arrival of the CBT.
IV adrenaline 1 mg bolus.
Preparing IV adrenaline bolus.
However, most patients who develop cardiac arrest in hospital have abnormal vital signs up to 6 to 8 hours or more prior to the time of cardiac arrest. This presents a window of opportunity to intervene effectively if we can identify these patients early. Therefore, another important component is the Early Warning System, or EWS. In addition to identifying patients at high risk of clinical deterioration, the EWS also provides standardized criteria for escalation of care and a common language for healthcare staff to communicate the severity of illness quickly and effectively. SGH adopted the National Early Warning Score, or NEWS, for our EWS. NEWS is a well-validated scoring system in which a score is allocated to common physiological measurements. A risk level of low, medium, or high is then determined based on the total or aggregate score. All hospitalized patients will have routine monitoring of their parameters and NEWS risk levels. Any escalation of the risk level from low to medium, low to high, or medium to high triggers an EWS activation. Ward nurses will inform doctors of the clinical situation, and the doctor or medical team is then expected to review and assess the patient in a timely manner.
Dr. Gold, this is Thomas Malik from Ward 45. I'm calling to inform you about Mr. Tan in room 4-1. He is a 40-year-old man with hypertension and diabetes.
Hello, I'm the ward doctor. How are you feeling right now?
I don't feel so bad. I feel quite breathless.
Let me examine your lungs. I'll get the nurse to increase the oxygen for you. Can I have an oxygen mask, please? You're breathing quite quickly, and I'm worried that your pneumonia is getting worse. So I'll be getting the nurse to increase the oxygen for you, and then we'll also be doing some blood tests as well as a chest x-ray for you.
For critically ill patients in the ward or patients who do not respond to initial intervention, Rapid Response Teams, or RRTs, are activated by the ward teams. RRTs are multidisciplinary teams equipped to bring critical care expertise to the bedside. Endotracheal intubation, initiation of vasopressor support, or point-of-care ultrasound are some of the interventions performed by the RRTs to assist with assessment and stabilization of critically ill patients. RRTs also help to expedite urgent transfer to the intensive care unit so that these patients can receive the treatment and support they require as soon as possible. In addition, RRTs also assist with difficult discussions about goals and extent of care in critically ill patients. The aims of the RRT are to reduce cardiac arrests, ICU admissions, and ultimately, patient morbidity and mortality. Together, these form the rapid response system of our hospital. The ward nurses and doctors from primary teams play an important role in all deteriorating patients. They share important clinical information about the patient, initiate and assist with resuscitation, and facilitate communication and transport where required. Finally, it is also important to consider advanced care planning for some of our patients. When appropriate, early discussions of goals of care should be initiated so that we can align the care provided with what is most important to our patients. We seek to continually improve our RRS and safety for our patients. Thank you for your kind attention, and we hope this video has been useful.